Hi, my name is Bethany Weiler. I'm one of the pulmonary critical care physicians here at Logan Health. So lung cancer, unfortunately, is one of our most common cancers. It's currently third in the United States. It trails behind breast and prostate cancer in women and men, respectively. But unfortunately, it's one of our most common and our leading cancer killer. It kills more people per year, lung cancer does, than breast, colon, and prostate cancer combined. About 1 in 5 people who die of cancer will die of lung cancer here this year. The reason being is that, unfortunately, like many other organs, the lungs don't have pain fibers to speak of. So cancers can grow undetected for a really long period of time. When it does start causing symptoms, when it starts causing symptoms like cough or shortness of breath or coughing up blood or pain, that's generally because it's invaded or moved into other vital structures. And generally that means it's a later stage. Unfortunately, once it's reached a later stage, the prognosis for lung cancer is very poor. So we have to detect these cancers before patients become symptomatic from them. If you've waited for symptoms, we've waited too long. That's why lung cancer screening is of utmost importance and probably our best tool to prevent lung cancer deaths here in the Flathead County. Lung cancer screening ultimately involves a regular CAT scan. And a CAT scan is a fancy x-ray. You go through a big tube. It's a very short procedure, generally no more than a few minutes. And what it does is create a map of the lung and allows us to look for spots. It is better than an x-ray for detecting these spots on the lung, so x-rays themselves are unfortunately not effective at identifying these spots that we want to keep an eye out for that may represent early cancers. But the CAT scans are great. And if you are between the ages of 50 and 80, if you've smoked for a good portion of your life, or you continue to smoke or have quit in the last 10 to 15 years, you're probably eligible for lung cancer screening. So I'd highly recommend you chat with your primary care doctor about that. If our best tool for preventing lung cancer deaths is lung cancer screening, our second best tool is early identification and early diagnosis. Previous methods for diagnosing lung cancers were limited by the size of the spot. So if the spot is too small or the spot is around the edge of the lung, it's very difficult to biopsy and can actually represent a good amount of risk to biopsy. So very frequently we would follow these to see if they changed. But sometimes that does represent a missed opportunity for diagnosis. What the ion robotic bronchoscope allows us to do is biopsy even significantly smaller spots on the lung than we ever have been able to in the past. And it also allows us better accuracy and better safety profile for doing so. So again, we can diagnose those spots earlier than we would have otherwise. And if you do, God forbid, have a cancer, it allows us to get you to treatment quicker. In conjunction with the acquisition of the robotic bronchoscope, we've also created a high-risk pulmonary nodule clinic. And what the high-risk pulmonary nodule clinic is intended to do is to take these patients who have findings, whether on lung cancer screening or just incidentally discovered some other way. It allows us to take those patients who have spots on the lung that ultimately have some concerning signs for cancer and to get them from identification to diagnosis quicker. So this clinic is intended for you to be seen within a week or so. If you do require any additional procedures, any additional imaging, that gets done within another week or two. And if, God forbid, you end up having a lung cancer, it takes that path and streamlines it and makes it significantly shorter from the time that we recognize that you have a spot to the time that we diagnosed you with a cancer and then treated it ultimately, which again is only going to help your survival.